where every birth is a one which is happily to be received. Now, for this sorrow state of affairs, over to Dr. Professor Ferdousi for an excellent deliberation, waiting to hear. Thank you.
Very good evening to all of you. It's nice to be joining in a very important meeting like this. I thank personally Dr. Laxmi and her team to inviting me and giving me opportunity to talk on the stillbirth on behalf of South Asian Federation of Obstetrics and Gynecology, and especially touching the region and all the countries. This is, you understand, this is a picture of stillbirth. I'll just call upon the audience to close their eyes and to touch this baby. Say, this baby has been delivered by one of us. No life. Total silence. It's a silence we need to be broken. Now open your eyes and let us see the problem. So there are 20 million babies are projected to be stillborn. Sorry, what's happening? Yeah. Among this 20 million, 2.9 million stillbirths could be prevented by accelerating our activities. And the burden is enormous. One baby is a stillbirth every 16 seconds, nearly 4 in every minute. So this is a huge burden. And in the past 2 decades, 48 million babies died. And 84% of these babies are stillborn, especially in lower middle income countries like us. And it should be known by us that over 40% of the stillbirths occur after the onset of labor. Now, how to define stillbirth? There are many definitions, but the WHO defines that for the sake of publication, we should take 28 weeks or more till birth is the definition. Because in the studies, we have seen that only 60% are defined like that, but there are other definitions that can be personal, but it has to be for international purpose. We must define this like this. Now, where did we? The lowest countries, we can see that Finland and Singapore, but the highest are in Africa and in our region. And if we look at the volume of stillbirth, the first 10 countries, out of first 10 countries, 4 are in our region, including India, Pakistan, Bangladesh, and Afghanistan. So this is our region, and this is the contribution from our side. Now, what about region ways? So this is our region, and we are the second highest in stillbirth rate. Similarly, as low and middle income countries, we contribute in these states. And if we look at the percentage of stillbirth in our region, the highest percentage are in, we'll be looking at it much closely, but you see that Afghanistan and Pakistan is highest, followed by Bangladesh, and the rest of the countries are following this. Now, what about the timing of stillbirth? Average is 40% during labor, but in our regions, in South Asia, it's about 40% of the days are during labor. About 50% of the day occurs during labor. And we know that there is a UN declaration of action plan for ending preventable stillbirth death. So it's every newborn action plan aims to end the preventable deaths, setting first ever national mortality target. And that is it should be less than 12 neonatal deaths per 1,000 live births. And each country needs to reach less than this rate. And we have to note that this is not included in the SDG, but it has been included in the Global Strategy for Women, Children, and Adolescent Health. So this is the progress in the last a few years from 2000 to 2019. I mean, it's 19 years. So the 33% reduction in the stillbirth, and this is the world, and in SEER region, our progress is much better. We have reduced about 50%. We have shown neonatal mortality side by side, but that we understand that there is an intricate balance between stillbirth and newborn death. Because if we delay the delivery, it becomes a stillbirth. If we delay earlier, it becomes a newborn death. So there is a strike to be, we have to strike this balance as well. And this is 25% of the stillbirth occurred in our region, in South Asia region. Now, if you look this closely, this is our region. And in Afghanistan, the stillbirth rate is 28.4, but the annual rate of reduction is 1.4. So it's very slow, with percentage reduction of 23.2. For Bangladesh, though the rate is a bit lower, but the annual rate of reduction is quite higher, reaching the percentage reduction in 19 years of 41%. In Bhutan, they have done a very good activity on labor and delivery management. So their rate is 9.7% and annual rate of reduction is 2.8%, giving percentage reduction of 41% almost. If we look closely at India, the rate is very good. It's their neonatal stillbirth rate is almost 14%, and very excellently, their annual rate of reduction is 4, giving the percentage reduction of 53%. Maldives is the best in the region, I think. So the rate is 5.8. Reduction is 4.5%, and the percentage reduction is almost 58%. Nepal also in the, though the 3, and their percentage reduction is about 44%. Pakistan and Afghanistan stillbirth is quite high, and the percent reduction is 23. I think there is a connectivity problem. Can you hear me now?
Yeah, we can hear you.
Hello?
Yeah. Dr. Ferdousi, we can hear you.
Okay, thank you. Okay.
Take
so
your time.
In the South Asia region,
we can't
there
see
are
your
two.
Slides. You share your screen again. Your screen sharing has gone.
Again.
Yeah, please reshare.
Something is happening.
Yeah, no problem.
Just wait.
Just yeah.
It's not responding somehow.
If the slides are posted, we can show them from here.
You want me to share your slides?
Yeah.
Is it okay?
Yeah,
can you see it now again?
Yeah, just
okay.
Yeah. Fantastic. Make it slideshow. Yes.
Yes, thank you. So if we look at the target of our region, then this is the picture. Because let me go back. Because if we look closely, we'll be seeing that Bhutan, Maldives, and Sri Lanka have already achieved 2030 targets. Assuming the current rate, India is likely to achieve, but Afghanistan, Bangladesh, Nepal, and Pakistan will fall short of 2030 event targets, SDG targets. And this is our goal. The India is 10 by 2025. Bangladesh aims for this, but with longer achieving time. So this is the practical situation. And this rate is, we are progressing, but the rate is quite slow, because in first 9 years, we reduced about 19%. But in the second 9 year, last 9 year, we reduced only 17%. And this is the progress, though we have reduced this region, South Asia region, we have second in reduction because our rate is quite high, but still we are falling behind. And let us see this picture, that this is the situation that India will be taking over, but the rest of the countries need to be accelerating. And this is an analysis which shows that if which country will be achieving, this is our region, which country will be achieving stillbirth rate. So except these 4 countries, Afghanistan, Bangladesh, Nepal, and Pakistan, most of the countries will be reaching the 2030 goal. So this is the expected year, which country will be. So regarding Afghanistan and Pakistan, they may reach this goal by 2050 if they do not accelerate. Similarly, Bangladesh will be falling short as well, Bangladesh and Nepal. So what we need to do? So this is a projection from WHO, which says that Nepal have to accelerate twice to reach the goal. Bangladesh has to accelerate about 4 to 5 times. But if we see the Pakistan and Afghanistan, which is at the end of this slide, so they have to accelerate almost 8 times to meet the goals. So if we continue of this rate, there will be 22 million stillbirths. If the current trend is maintained, then there will be 2.6 million babies will be saved. If we can meet 2030 target, then 5.6 million babies can be saved from the stillbirth. Now, with this rate and target, what are the causes of stillbirth? So from different studies, there are 5 big causes. First is childbirth complications, maternal infection in pregnancy, that is syphilis, maternal conditions, especially hypertension and diabetes, fetal growth restriction, and congenital abnormalities. So these overlap with causes of maternal neonatal deaths. This slide, which shows different regional progress, and if we here, this red line is for South Asia. So this is see where we are with very high rate. So we need to really accelerate to reach the target and goals. Now, what are the interventions? WHO in Lancet series, there were 10 interventions, priority interventions, which has been declared as evidence-based. First is periconceptional folic acid fortification, which this is the number and percentage of reduction with these interventions. Then malaria in pregnancy and syphilis screening treatment, almost 6%. Then hypertensive disorder in pregnancy management, diabetes management, so each has a role. And then fetal growth restriction management, 4% reduction, induction of labor at around 41 completed weeks. And finally, very good obstetric care, 3-level obstetric care. So that saves about 45% of the stillbirths. So this is covered in basic antenatal care. These are covered in advanced antenatal care, and these are childbirth care. So 1.1 million stillbirths could be prevented, but need higher coverage and quality of care. And these are 3 levels of obstetric care: basic care, specialty care, and subspecialty care. So several programs we has taking the life cycle approach has to be taken. And that includes, first of all, of course, family planning and preconception care. then antenatal care, then childbirth care, and if death occurs, respectful and supportive care. So this is the total interventions which is needed. And if we look at this preconception care, very few in countries of our region has very good. Yesterday, we had a very good meeting of SAFOG region for reducing stillbirth. I'll be presenting the recommendations from that. So there we have learned that in Sri Lanka, they have reached more than 60% preconception care. So that is very important. And so these are the interventions which already we have discussed. And so we need not only to have good antenatal care, we need to look at the quality of care as well, so that we can really reduce stillbirth rate, and that will in turn reduce newborn care and newborn death and maternal death as well. So it is called triple investments. So each and every country of our region should create a plan. I think many of the countries have that, but that has to be strengthened. Create a plan for stillbirth reduction, collect accurate data on stillbirth rates and causes of death that we lack very much, assess disparities in stillbirth rate by ethnic regions and location, and audit stillbirths for causes and preventability, reduce stigma associated with stillbirths. For communities and families, we have to ensure empowerment of women and families, set up pregnancy improvement committees, provide birth plans and transportation, reduce stigma, and provide bereavement support. So there should be systemic collection of stillbirth data, improve data on pregnancy outcomes, especially to know the specific causes, then improve understanding of stillbirth as a public health problem. And stillbirth are closely linked with maternal and newborn need. We know that stillbirth rates are higher in countries where women have less access to good quality of care in pregnancy and childbirth. And improving access to interventions that reduce stillbirth will improve maternal and newborn health too. Comprehensive efforts must be made to strengthen the capacity of the healthcare delivery system, and perinatal death audit is very important. So suboptimal care contributes to around 30% of the stillbirth. So we emphasize on auditing. So these are the recommendations, even recommendations. And if we, yesterday basically, we have taken some common recommendations to be followed in the region, and that includes awareness development program, raising voice. So for that if we ask our general obstetricians, I think most of them do not know that 50% of the deaths occur during labor. So we need to strengthen the labor monitoring. Then advocacy, so this knowledge has to go to our obstetrician. Advocacy among policymakers, managers, donors for the importance of stillbirth prevention. So we have asked our societies to have at least 2 meetings with the policymakers in next 3 months, because after 3 months we'll be having a follow-up meeting. Then can we develop an IC material on stillbirths for general distribution for advocacy and awareness raising? Next coming the supporting the families and the client. In clinical and public health setting, we must include the bereavement care as a compulsory program component in stillbirth prevention. It not only helps in soothing the women, it also acts for prevention of the next stillbirth. So we need to develop SOP, job aids on bereavement care, and is to be adopted in the training program, and the training has to be done. So we will be looking at this, requesting all the countries to adopt this bereavement policy in the stillbirth management protocol. Now, strengthening the health service need. Can I just, because I cannot see the upper part, I need to lower this. Okay. An integrated programmatic approach within the continuum of the care for women and children. We as professionals has to take the responsibility that what the state is doing, what the government is doing, are they supporting us enough? So this has to be done by the government mainly, but we need to execute this. Planning preconception care to improve reproductive health. This has been included in Bangladesh strategy now. High quality antenatal care to promote a healthy pregnancy, and 8 antenatal visit is to be adopted and to be executed. So this is the new WHO, current WHO protocol for antenatal care. We must adopt this. The next is high quality care during delivery to support a safe live birth, use of labor care guide. So we just heard from Professor Arul Kumaran a few sessions back in this conference only about the labor care guide, and this is the recently published WHO labor care guide. So we that has been going to replace the protograph. So we need to understand this, institute this, adopt this in the national plan and execute. Then we need training as well for this, and we need to implement respectful, supportive care for women, her family and community if a death occur. Access to comprehensive family planning services. So this is the recommendation from our region as well, and for the prevention of stillbirth in our region, and especially empowering women, which is a difficult job, but we need to do this. Now, to ensure the stillbirth target in the National Maternal and Newborn Strategy, I think it is there, but we need to have subnational and interim period goals so that we can assess that are we in the right path. Then creating district-wise database for stillbirth and managers, monitoring of the stillbirth at all level. Regarding database, many of our country, we have included this in national MIS, but in our institutional level and in our personal practice level, we must at least ensure some data collection so that we can know the cause of death. Then realizing the equity. Eliminating preventable stillbirths requires strong political commitment and sustained investment to give every baby a fair chance. So we need to include our politicians so that they remain still here. Here we see the show our health minister disseminating the maternal health SOP. So that is a great achievement for us, because these people must understand the importance so that the correct investment is there, and they push their underserved to the people who serve under them to act on the stillbirth, and reaching out for the poor communities and households. So that has to be done. And also align the stillbirth definition measures, which I have already said that we need to keep this standard. Identify and collecting relevant minimum indicators in HMIS and also in the personal and institutional data, including the cause of death denominator has to be the total birth that has to be taken care of. And encouragement, I will encourage everyone to have research on stillbirth, because this data we lack very much, and we don't have our standardized cause of death, percentage of death, and area-wise data as well. Now, this is my last slide. I will end with this, where it has been shown that the maternal mortality rate in our region, in our countries, we have tried our best, and we could reach the MDG, and we'll be reaching the SDG. Similarly, neonatal mortality death rate has been diminished and will be diminishing. But if we look at the stillbirth rate, look, if the present trend remains, then we cannot reach this goal. So we have to accelerate our activities, and especially as clinicians, we must be very careful about the preconceptional care, antenatal care, delivery care, so that our women gets best care and the stillbirths can be prevented. And so there are mainly 4 recommendations: raising the voice, quality of care during pregnancy and childbirth, supporting bereaved women and families, and measuring every stillbirth. So with this, these are the resource persons which can resource materials which can be used for understanding and implementing good care so that the stillbirths can be prevented. And let us work together for a better future. Thank you all.
Thank you, Professor Ferdousi, for this excellent lecture